Dr. Sharpnack, thank you for agreeing to be a part of our special feature series on the changing healthcare landscape in Cleveland. We here at WKYC appreciate the efforts of the healthcare community. We understand that there is not only a nursing shortage looming in the state, but also a primary care provider shortage. Physicians have been the primary providers of healthcare in the past, but now there is a move toward nurse practitioners and physician assistants filling this void in providers. Can you speak to this issue?
Thank you, Rachel. It's a wonderful opportunity to be here with this feature on healthcare. The growing supply of nurse practitioners, which are also known as NPs, presents a potential solution to address the rising demand for primary care and primary care physician shortages. Advanced practice registered nurses, known as APRNs, specifically nurse practitioners, also known as NPs, provide high-quality, cost-effective care to patients in need of primary care services. Currently, 23 states and the District of Columbia allow NPs to practice to their full scope of education and training. As a result, access to primary care in these states has improved and has increased. Ohio isn't one of those states. Regulations restricting full scope of practice in Ohio are barriers to full access to high-quality health care.
We have lots of healthcare access in Northeast Ohio, don't we? Or if not, what has changed?
Well, Rachel, Medicaid expansion has had a considerable impact on the Cleveland community and our healthcare systems by providing coverage to over 360,000 newly eligible Cuyahoga County Ohioans. This region has the most eligible Medicaid enrollees in the state, as more than 30% of the residents of metropolitan Cleveland are below 200% poverty. Medicaid coverage allows individuals to get needed health care and supports the safety net infrastructure. It is vital to note, though, that coverage doesn't equate to access to quality care. Many areas are experiencing shortages of primary care physicians. In Ohio, it's projected that there'll be greater than a 13% deficit in primary care physicians. And also, many time providers may not accept or they limit the number of low-income and Medicaid-eligible patients due to lower payments. Nationally, over 83% of nurse practitioners accept new Medicaid patients as compared to 69% of physicians.
How would the Cleveland area benefit from this change in Ohio's laws?
State full scope of practice regulation is associated with higher nurse practitioner supply in both rural and primary care shortage areas like Cleveland. Regulation plays a role in maximizing capacity of the nurse practitioner workforce in these underserved areas, which are most in need for improvement in access to care. This information may help inform state regulatory policies on nurse practitioner supplies, especially in underserved areas. Consumers are highly satisfied with the care provided by nurse practitioners, and nurse practitioners have been shown to decrease patient hospitalizations, emergency room visits and length of stay, while reducing healthcare costs for patients, institutions, and taxpayers, while lowering time and income loss from work. Nurse practitioners produce at minimum nearly 2 times more value than cost, and potentially as much as 5.3 times more value than cost.
This sounds like a great opportunity for our region. What should our listeners do?
Rachel, it is a great opportunity for citizens of Ohio. Nurse practitioners can make a difference in the provision of health care in the state of Ohio. With nurse practitioner autonomy being legislated in an increasing number of states, nurse practitioners are able to fill gaps in preventive care and keep Americans healthier. More nurse practitioner availability also decreases the number of citizens not receiving primary care, as well as those seeking treatment for otherwise preventable conditions in emergency rooms around the country. By removing state scope of practice barriers, access to healthcare issues in Ohio could be alleviated. Please reach out to your state representatives and send the message that Ohio should join the 23 other states that have found full scope of practice to be an answer to their healthcare issues.